Now, our next speaker, I'm really excited to hear about nursing and lifestyle medicine. Dr. Crystal Oldman has a real passion for nursing, has done a lot of community nursing as well, and it's something that I'm really excited to hear about. So, with no further ado, Dr. Crystal Oldman.
Thank you so much, and thank you for inviting me, and really hard to come after Professor Samir Gray. Wonderful session, and I kind of want to stand here and say everything he said, but involve nurses, which I know you absolutely support as well. So, nursing. Any nurses in the audience? Yay! About 10 or 12. Fantastic! Well done! Because what I want to say is that lifestyle medicine is our core purpose. It's within our core purpose as nurses, and yet we rarely talk about it. And I want to talk about community nursing because that's what I do, that's my background, and I'm the Chief Executive of the Queen's Nursing Institute, which was founded by someone who you'll recognise, Florence Nightingale, along with William Rathbone, where in 1887 they realised that nurses were not trained to work in people's homes. So that's what we did. We set up the training for nurses to work in people's homes. But nursing is in the community is now in a whole world of different roles and environments of care. And I want to highlight in my session the unique nature of nurses who work in people's homes, communities, GP practices, alongside many of you here today, and their potential to look at lifestyle, their potential to make a difference to people's lives, if only there were enough of them. And it really is truly our core purpose from when we started in 1887, when we were established well before the NHS, but our core purpose was all about free access to nursing in the home for those who couldn't afford it, and it was also about health inequalities, recognising the social determinants of health and addressing that through nursing, through nurses going into people's homes. So that has always been our focus at the Q&I, and we now support nurses who work in a whole variety of different environments and in different roles. And our focus, when you look at those 6 pillars, is, you could say, nurses amongst you will recognise these are some of the elements of a nursing assessment. In whatever role you're in, these are the elements that you will be looking at when you first meet a patient, a resident in a care home or an enablement home. I love that idea as well. Let's drop care, let's talk about enablement. And so this goes to the DNA of nurses. But we only have around 15 nurses here today. So do nurses recognise this as part of their core purpose? Please do go and have a look at this on the website. Our website. We were recently commissioned to show, to develop this infographic to show the touch points in people's lives where nurses are involved. And I love the expression cradle to grave. I love even more sperm to worm. And that was, I have to take no credit for that. That was learned by one of my GP colleagues, from one of my GP colleagues. So community nurses, if you look at that, where they touch people's lives in a whole variety of different roles. And nurses are the clinicians who spend the most time with patients. They understand how their patients live. Nurses working in the community go into people's homes. They're not just there for the patient, for the person, the individual that they're going to see. They're also there for the carer, for the children, for the older relatives who might be in another room, but you are still part of the assessment is to talk about how that person is living, what the stresses and pressures are for them, and how to enable them to live their best and most healthy life. So it's not about going in and doing a task as a nurse. It's much, much more than that. And many of you here, there's lots of GPs here, will work with nurses every day. Your general practice nurses in your practice will be talking about this every day with their patients. And you can see in the infographic that general practice nurses are there as a touch point at every point in people's lives. They are, in fact, the only nurses who see patients from beginning of life to the end of life. Most others are segregated into parts of people's lives. So I want to emphasize how important nurses are to improving the health of our nation, and to remind ourselves how many nurses are there and have the potential to do this work. So the potential of community nurses, and when I say community, I don't mean district nurses, I mean any nurse who works in any setting in the community, and that includes working in people's homes, it includes working in GP practices, in care homes, and in specialist roles throughout the community. There are around 730,000 registered nurses. I wonder if you've ever thought about how many of those work in a community role, and therefore what the potential is for nurses to really impact on people's lives, how they live their lives, and how they can live their best and most healthy life. Well, we're doing a piece of work at the moment at the QNI, because actually nobody knows the answer to that. It's never been done. We've never collected the data on where nurses work in the community. If there are around 700,000 registered nurses, we estimate, I'm not allowed to do back of the envelope, but I am doing back of the envelope, we estimate that there are around 300,000 that work actively in the community. Imagine the difference that over 250,000 nurses working in community settings, day to day, contact with their patients in their homes, knowing how they live, knowing the choices that they're making, knowing the pressures and stresses that they're under. Imagine the difference that they could make every day to our population. And here are just some examples that we have here. So a general practice nurse, a health visitor. Health visitors, amazing, but we haven't invested in health visiting. Community children's nurses, district nurses, homeless and inclusion health nurses, and care home nurses. These are just a few examples. There are many more, including, we were talking earlier, school nurses. So we're about to run a campaign which is going to be called A School Nurse in Every School, because most pupils don't have access to a school nurse. And that's a massive missed opportunity for creating health and healthy lives. I was in a school 2 days ago, 70 sixth formers, and I was talking about careers in health and social care. And I said, hands up, anyone who has seen a school nurse. 70 pupils, not one hand went up. Look at that missed opportunity. We used to invest in school nurses. There are now only 4,000, just over 4,000 registered school nurses on the Nursing and Midwifery Council register. How did we get to that position when we thought it was okay for young people not to have access to a school nurse? And school nurses are amazing. When we did a piece of work, it's on our website, we asked school nurses to tell us what difference they made. Tell us your story. Tell us about, anonymously, tell us about the students that you've supported. 75% of those stories relate to mental health. Incredible. I was blown away by that. But we only have 4,000 of them, and that they're never going to be able to do that kind of detailed work with pupils everywhere unless we invest in school nursing. And I haven't even touched on occupational health nursing. And the good thing about nurses is that there are lots of us, there aren't enough, and we are in every town and every city and every village. So we're there. We need to be thinking about how we invest in our workforce. And our workforce are really good at embracing new ways of working. In general practice, you will know, group consultations. General practice nurses have really embraced that. One of the first, I think, to embrace that. Absolutely brilliant. Personalised care, making sure that we ask the patients, the people, the residents, the citizens, asking them what matters to you. Not what's the matter with you. You know about that movement. Nurses really embrace that. And we know how people live. Then we're very good at embracing digital and new ways of working that have been accelerated through the pandemic. So workforce. I do want to say a little bit about workforce, and I do want to say the work that we're doing around workforce and being able to demonstrate the economic value of employing, educating, supporting nurses. Health visitors are nurses who've had additional training. But we're not investing in health visitors. Who amongst you knows your local health visitor for your practice? That's truly shocking. I think about 25 hands went up. Anybody who's been in practice a while used to know their health visitor? Yeah, okay, about half the room used to know their health visitor. Don't need any more research. I think that just demonstrates what's happened to health visiting. Look at the numbers. We're depleting our health visiting numbers. These are the numbers that are actually registered, but the estimate from the Institute of Health Visiting, fantastic organisation, charity by the way, that we work very closely with, has shown that there's around 6,000 to 7,000 actively employed health visitors. Other health visitors have gone into other roles where they're not actively delivering health visiting services. We're not investing in health visiting. Why are we not doing that? Look at the difference that health visitors can make right at the beginning of life to the children and to the families as well. They're not just there for the children, they're there for the whole family. And they are the experts in all of those things that I've listed there that I don't need to read out for you. And those of you who know your health visitor know how brilliant they can be, but those of you who have never seen them or don't work with them probably have no idea what they're doing and what their potential is. We absolutely need to invest in health visiting, and the Institute of Health Visiting are doing a lot of work to lobby around that with the evidence of the difference it makes to the health of the people they serve. District nurses as well. So often I get comments around district nursing where I'm told, district nursing, how difficult can that be? Leg ulcers and cups of tea, surely. My goodness. Anyone a district nurse here? No. Okay. Well, I can't get anyone to verify this from the audience, but look on our website, you'll see all the evidence of the difference that district nurses can make to people's lives. As I said to you before, they don't just go in and see the person. It's not a task-based service. This is about going in, assessing, and working with the entire family. It might just be an individual, but you also work with the relatives, the carers, the children, the spouses, and it's then about the health of everybody that you're interacting with. It's again very much about personalised care, and it's very much about population health and recognising that you need to adapt your service in accordance with population health need. Now, district nurses undertake a programme, just like health visitors, of a year of additional education in order to learn all these skills and to work independently. And one of the other things I should say is that all of these services that I have spoken about, health visiting and district nursing and school nursing, these are all nurse-led services. And it requires additional qualifications to do that. You can't qualify as a nurse and then go and lead a service. And this is why. So anyone know Professor Alison Leary? Absolutely amazing professor of workforce modelling. A nurse by background, a specialist nurse by background in cancer care. And she works with us part-time. And she has observed nursing in more than 40 different environments of care. And this was her conclusion. She allows me to say this. District nursing is easily, I love that word, easily the most complex nursing work I have ever observed. So this is difficult work, and that's why additional training is required. And it's about that complexity. And we don't do it well enough. We've been trying to encourage nurses. We don't articulate our value well enough. We've been trying to do this over the last few years to get nurses to articulate their value. Because investing in district nursing services will bring health value. It will be health creating. Investing in health visitors, school nurses, all the nurses that I've described will create health, and it will make a difference to the population served. But we need that additional education. And within that education is a focus on lifestyle. There is a focus on population health, personalised care, and this is where nurses will learn how to apply that to the work that they do in serving their local population in whatever role. And we need more nursing students to understand community. We need nursing students to have an experience in primary care so they understand this is an option for them, and they understand what roles are possible in the community, working with yourselves as GPs, working with the district nursing team, working with the health visiting team on placement, but very, very few of them get the opportunity to do that, even though 300,000 of them are in those roles. So we need more nursing students to come and work with you as GPs as well, and with the nurses that work in your practice. And so we are often seeing campaigning for that as well. And I just wanted to finish on a couple of slides. One is about international work, and just it sort of makes you stop and think. We belong to the International Council of Nurses. We just joined as a member last year. And what is really significant to me in talking to international colleagues all around the world, nursing colleagues around the world, is that the focus is on primary care. And actually, because nurses are really high value, the focus is on nurses, trying to get equal access to a nurse across the world as possibly the only clinician that they might ever meet. So I think we need to learn from that and think about primary care here, the nurse's role in the community and primary care, and think about the value that they bring to the health of the population served. And lastly, as the QNI, one of our first missions is around influencing policy with data and evidence. We never do it without influencing policy. But so often, I go to national meetings and I'm the only nurse around the table. I don't want that to happen. I don't want to be the only nurse speaking for nurses. We need loads of us around the table. We're in so many different roles. I can't possibly know about the potential of every possible role and the detail of it. But it's really important that we as nurses are recognised, we can articulate our value, the difference that we make to the health of the populations we serve at all ages. And our mantra is, as nurses, if we're not around the table, we will be on the menu, and shiny new roles that are potentially untested will be put in place instead of investing into what we know works really well for the health of our populations. So I'm going to finish there with that call for, please join me in articulating the value of the nurses that you work with. Be our advocates. Because when I sit around the table, I get told, well, you would say that, wouldn't you, because you're a nurse. So what we need is our GP and our medical colleagues to be advocating for us, just like Professor Samir Gray does. So thank you very much.